Hi, I'm Dr. Rainier Guiang's digital avatar. I lead the regenerative medicine program here at University Pain Consultants. Today, I want to walk you through one of the treatments patients ask me about most, skin rejuvenation using PRP and PRF. In plain language, these treatments use your own blood to help your skin look healthier, fresher, and more youthful, without surgery and without synthetic fillers. So what are they? PRP stands for platelet-rich plasma, and PRF stands for platelet-rich fibrin. Both start the same way. We draw a small amount of your own blood, just like a routine blood test. We then spin it in a centrifuge, which concentrates the part of your blood that's packed with growth factors, the natural healing signals your body already uses to repair itself. When we place those concentrated growth factors back into your skin, they wake up the cells that produce collagen and elastin, the proteins that keep skin firm, smooth, and plump. As we age, we make less of them. PRP and PRF essentially tell your skin to start rebuilding its own. PRF is the newer generation. It releases those growth factors slowly over 1 to 2 weeks, and it can even act as a natural, gentle filler. Because this works with your own biology, the results look natural and build gradually over several weeks. Patients notice smoother texture, softer fine lines, more even tone, and a healthier glow. It can help with under-eye hollows, dark circles, acne scars, sun damage, and that crepey, thinning look that comes with age. And it isn't just for the face. We can treat almost any area where you want skin to look healthier. The neck, the chest, and the backs of the hands all respond beautifully. This is also for everyone. Both men and women see the same kind of natural improvement. There are a few ways I can deliver it. The first is by injection, placing the growth factors precisely where your skin needs them. The second is microneedling, where we use tiny microchannels in the surface of the skin to drive the growth factors deep into the dermis. This is excellent for overall texture, pore size, and acne scarring, and often the best results come from combining both. Before we start, we apply a numbing cream so you're comfortable, and the whole visit usually takes somewhere between 45 and 90 minutes. Most people go right back to their normal day. Let's talk about safety. This is one of the things I love most about PRP and PRF. Because we're using your own blood, there's no synthetic material, no foreign substance, and essentially no risk of an allergic reaction. It's what we call autologous. It comes from you and goes back into you. Every treatment here is performed personally by a physician. The most common side effects are simply mild redness, a little swelling, or occasional bruising at the treatment sites, and those usually settle within a day or two. Serious problems are very rare. It does have an excellent safety record, but it's still a medical procedure, which is why we always start with a proper evaluation to make sure it's right for you. Because we're stimulating your own collagen, this is a gradual, cumulative process, so a series works better than a single session. For most patients, I recommend a starting series of about 4 treatments, spaced roughly 4 to 6 weeks apart. That spacing gives your skin time to build new collagen between visits. After your initial series, most people keep their results looking their best with a simple maintenance treatment every 6 to 12 months. Think of it like tending a garden. The series gets things growing, and maintenance keeps it thriving. If you'd like to see whether PRP or PRF is right for your skin, I'd be glad to talk with you. You can book a consultation through our website shown here, and we'll build a plan around your goals. Before we wrap up, a quick but important note. This video is for general educational purposes only and is not medical advice. It is not a substitute for a consultation with a qualified healthcare provider. Results vary from person to person and are not guaranteed, and these treatments are not covered by insurance. Always talk with your physician about your individual situation before starting any treatment. Thanks for watching, and I hope to see you in the clinic.